those physicians who are not educated on RFA often will say, don't do RFA because it's going to cause scar tissue to develop that's going to make a future surgery harder to do. And so is there danger of the RFA causing there to be scar tissue in the neck where the thyroid is going to adhere to the surrounding structures? Is that an unfounded concern?
Yeah, and that's a great question because it came up again today in our discussion during
Oh
our
my
course.
goodness.
So you're covering everything. Like we should have videoed the course today for you too. It would have
I
been
would have
great.
loved to have seen it.
We got to tell you next time. We'll tell you. Okay.
Okay,
So
thank you.
yeah, I'm sorry that we didn't think about doing that, but next time
Mhm.
we will. So this is a concern because um, you may be creating enough thermal damage that maybe you're going to create scarring beyond the thyroid. But think about it. This is directed treatment. We're
Right,
confining it to the thyroid nodule. This is not like ethanol or slash alcohol, which may extravasate. That means getting out to the surrounding tissues.
right.
I've operated on a few of those patients, and that is very challenging. I would not want to do a surgery like that. But
Mhm.
RFA, if you're really limiting it to that thyroid nodule in particular, and you're not disturbing the surrounding capsular tissue and beyond, then it really shouldn't pose too much of a problem. Now, I can say to you, and even in asking my colleagues in North America, I don't think any of us have operated on a patient who's been treated with RFA. So that's encouraging, but it's also like, well, whenever we're going to do it, what are we going to find? And so it's a
Mhm.
little bit like, anxiety provoking if we
Mhm.
ever have to do it. But some of the colleagues that I've spoken with in other parts of the world have said it really isn't much of a challenge at all because of what we discussed before, the moving shot technique, the focal intervention with the heat via the needle, understanding where the needle point is at all times. It's a very controlled way of delivering that energy as opposed to using ethanol, which may leak out into the surrounding tissues, and that causes a lot of intense fibrosis.
Mhm.
I've hated every case I've done that has had ethanol before.
Mm.
So, you know, I can't tell you I know for sure, but it's
Mhm.
not something I really worry about too much.